In the medical literature, investigators utilize proportions instead of raw numbers. So let's say you're interested in knowing if your vaccination for hepatitis C is effective in Detroit and in Lake Angeles, Michigan. 1 year following a vaccine campaign, you find that the number of new cases of hepatitis C in Detroit is 6,730, whereas there are only 67 new cases of hep C in Lake Angeles. So was your campaign effective in the two cities? To answer this question, we need to use proportions. So here, we have 6,730 new cases of hep C in Detroit out of 673,000 residents. This gives us an incidence rate of 1%. In Lake Angeles, we had 67 new cases out of 290 residents. And in this case, we had a much higher incidence rate of 23%. In order to calculate disease occurrences, we need to know at least 3 pieces of information: the number of cases of disease in a population, the total number of the population of interest, and the time period of interest. So I'm going to use this example where I want to know the prevalence of Bieber fever among U.S. teenage girls in 2005. So first, I know that there are 100,000 new cases, and there are 5 million teenage girls in the U.S. in 2005. And my duration is I'm looking for new cases over a 1-year duration. In medical literature, we're looking at the impacts of interventions, usually drug therapies on outcome, which are usually diseases. What we want to know is if there's a difference in disease occurrence between our 2 treatment groups. The 2 main measures of disease occurrence we'll focus on in this course are incidence and prevalence. Incidence is the proportion, which is a simple division problem, of new cases of disease divided by the total population at risk for the disease. You can think of incidence as diseases that occur inside the study period. Prevalence is the proportion of total cases of disease in the total population. This means that you count everyone who has a disease as a case, even if they already had the disease at the beginning of your study. This is easier to understand through an example. So we're going to go back to our Bieber fever example. So in 2005, there were 10 million girls aged 13 to 19 living in the United States. Prior to January 1st, 2005, 5 million girls had already been diagnosed with Bieber fever. And then by the end of 2005, 2,500,000 more girls were diagnosed with Bieber fever. So what is the incidence of Bieber fever? Remember, incidence we're interested in within our time frame of new cases. So here there were 2,500,000 new cases of girls being diagnosed with Bieber fever during 2005, and the number of girls at risk is 5 million. So we had 10 million girls total, but 5 million already had been diagnosed with Bieber fever by the time January 1st, 2005 came around, which means that there were 5 million other girls that were at risk. So here we've got a 50% incidence. What's the prevalence of Bieber fever in the United States? So prevalence is going to be our total cases, which is the 5 million that already had it coming into 2005, plus the 2,500,000 more girls that were diagnosed with Bieber fever during 2005. And that is divided by the total population, which in our case is 10 million. So here we have a 75% prevalence. By the way, I'm using Bieber fever as a case example in an attempt to increase engagement, but these studies are commonly done on national, state, and city levels for diseases such as hepatitis C, tuberculosis, and other chronic disease states. Incidence is especially important in medication trials because it is used for calculating relative risk and absolute risk. Prevalence is very important in epidemiology because it tells you about the current state of affairs for a given disease state. So incidence is most important in drug trials. If I'm designing a trial to determine if aspirin causes more bleeding than a different medication, then I would want to exclude patients who already have the disease when the study starts. If I keep patients who are already bleeding in the trial, that may impact my results. In other words, I'm interested in any new bleeding that occurs, incidence. There are some other important statistics, the first being mortality rate. This is the number of deaths in the total population over a given time period. Another important statistic is going to be 5-year survival rate. This is the number of patients who live to 5 years from the time of diagnosis of a specific disease. When there's more than one group, incidence rates are easier to interpret using a consistent formatting. For trial results, we suggest using these 2x2 tables. So in this example, we have a trial with 2 treatment groups, and we can split them into the diseased, meaning they have the outcome yes, and the non-diseased outcome no. In their respective rows, we have whether or not they've been exposed or had the exposure. And so yes or no. I'll be talking more about these tables and giving examples on how they can be useful in the next section. But for now, we can see that in the first row, meaning exposure yes, the incidence of having a disease in that group is cell A divided by the row total, which is A plus B. Similarly, the incidence in the non-exposed group would be C over C plus D.